also not be able to. Okay? Doesn't mean you have to shout, but you have to at least be clear and concise and forward. Okay? Any other questions? All right, I'm just going to do this. Usually I would be at the door, but I think I'm just afraid for everybody's safety today, including my own, and I'm going to go through everybody. All right, so I'm going to knock. Hi, can I come in?
Yes.
I'm pretending that I'm walking. Hi, Deanna. My name's Emmy. I'm going to be your physical therapy assistant today. How are you feeling?
Okay.
Okay. On a scale of 0 to 10, 0 being no pain, 10 being the worst possible pain, what number would you give your pain?
6.
Okay, so not so comfortable. Has anything changed since the last time somebody came in to see you? And is it okay if I put my hands on you?
Yes.
See, I have to obtain consent. So again, my name is Emmy. I'm the physical therapy assistant, and we're going to just be doing some things to make it a little bit more comfortable today. All right? All right. Did I miss anything? And then I'm just going to go wash my hands before we get started. And your heart rate and your blood pressure looks good, so we're going to go ahead and get started. So the first thing that we're going to do is I'm noticing that you don't really have any pillows underneath you yet. So what we're going to do is I'm going to go ahead and I'm going to come in and unweight your head. Time out for a second. The neck is a very sensitive part of the body. The head is a very sensitive part of the body. So when you come in, it's really important that you have a hold that's going to support the head and the neck while you're putting something underneath. So what we're going to do is we're going to go ahead. If she can, I'm going to say, Diana, can you go ahead and lift your head up for me? So she's able to do it. So she's more independent. Okay? Lay your head back down for a second. If she's a patient who cannot pick up her own head, she's more dependent, I'm going to have to come in, I'm going to have to cradle underneath. It's a little bit uncomfortable, I know. I'm going to hold underneath the occiput with my hands like this. I can turn you around for a minute. And I'm going to lift her head gently, and I'm going to slide the pillow underneath, and I'm going to lower it back onto the pillow. Okay? So still maintaining my body mechanics. I'm going to do it one more time. So we're going to pick your head up if you can, right? As much as possible, as normal as possible. Lower your head. We're going to do it one more time. So we're going to go ahead and lift the head up as much as you can. I'm going to help you the rest of the way. Slide the pillow underneath and then gently lower using the occiput. I'm not pulling the head. You can relax. And I'm not pulling the hair or anything like that. Okay? Questions? All right. And then the next thing that we're going to do is, remember our other points of contact? We're going to go top to bottom. Cephalo to caudal. We're going to go ahead and we're going to unweight her arms. We have a couple of options here, but because she's more independent and we're doing short-term positioning, I can go ahead and give her a pillow here and just ask her to place her hands on top of the pillow. So again, 1 and 2. Could be short-term or long-term. And then I'm going to go ahead and grab one more pillow. Okay. When I'm coming in at the legs, one of your slides says, and I'm going back to you, no crab claws. What do I mean by crab claws? No. Could be nails, could also just be new therapist kind of hands where you're not really sure what's going on, so you're kind of just pinching and pulling things that you might not understand. We're going to support above and below the joint that we want to move. So if I'm doing the hip and the leg, I'm going to come this way. I'm going to lift the leg, and I'm going to slide the pillow underneath. And I'm going to be as close as possible to the body and release. And I'm going to do the same thing on this side. Under and lift and slide. Again, maintaining the body mechanics and maintaining a neutral spine. What did I miss?
Ankles.
Any towel rolls over there?
Oh, she's right here.
You want to use one of these?
That's fine. Thank you. We're going to use the bolster, but you might also just have 2 towel rolls because what's going on with her heel and her calcaneator?
Pressure.
Still pressure, right? So I'm going to go ahead, I'm going to lift and slide, and then one more time, lift and slide. So now, did I relieve all my pressure areas?
Scapula.
Do you feel like you still have more pressure on your scapulas or less? Okay. Since it's a short-term position, it's okay to either leave her with this one or I can let go. You can let Or if she would like, this is again long term, I told you we're gonna be jumping back and forth. I can go ahead and slide this underneath, so she has one for each arm, which is more for long-term positioning, but again, we're talking about short-term, and I don't want everybody to be confuzzled about which one's which. Your scapula, which one feels better, your left scapula or your right scapula? Okay. Very good. Yes.
In a person with high blood pressure, would it be dangerous to elevate their legs for X amount of time?
That's a really good question. In terms of
Like really
like
bad
if
high
I'm
blood
at
pressure.
high blood pressure, so that because the heart is, the legs are above the heart and you're putting more pressure this way. It might depend, and it also depends on the presence of edema. So if there's a lot of swelling, and it also depends on the medication. Usually the only time that it's really contraindicated, because you can see it's not exactly so high above the heart
Right.
that you're kind of putting so much pressure on the blood flow going in the opposite direction. Can anybody think of a time when it's really dangerous to have the feet very high above the heart in terms of potentially blood pressure or something else going on in the body? Pregnancy potentially, but people do put their legs up during pregnancy to relieve.
Right.
Any kind of
It did feel
cephalic
better.
pressure?
I'm thinking about like being on your back.
You won't be, yes, exactly. Well, so we're gonna talk about indications and contraindications in a little bit, but you're not gonna be flat on your back for 5 months after pregnancy. So we're gonna get to that one. But this one is, she's not completely supine, but she has a pillow underneath supporting the head. But what's one time, I wanna go back to Giovanni's question. What's one time where something in the body is not working the way it should be working and you're not gonna wanna put extra pressure on the heart because you're allowing gravity to help blood flow towards it?
With DVT?
Good guess. So DVT we're always gonna be mindful of, and we're potentially not gonna even bother touching the patient because we're gonna need clearance from the doctor because they're at such risk. Does everybody know what Meg is talking about when she says DVT?
Deep vein thrombosis.
Deep vein thrombosis, right? There's always a risk with the DVT that it can become a pulmonary, an embolism of some kind. So we're not gonna move or touch that patient if we don't have clearance to do so. Anything else that could be happening? Good instincts then.
Atherosclerotic arteries.
Also good, right? We're gonna talk about venous versus arterial ulcers. We'll do that in a little bit. So maybe the veins aren't pumping blood the way they should, or the arteries aren't doing what they should. What about congestive heart failure and edema? Right? We talked a little bit, we touched on edema, and we said that edema is only there when there's a problem in the body, right? There has to be a medical problem for edema. It's not that you're waking up in the middle of the night and your leg hits a bed. When we have edema because of congestive heart failure, right, the heart's supposed to pump blood, and then all of a sudden it can't pump the blood the way it's supposed to, so we're not gonna add any pressure this way. So I know you're gonna get into all of that with Dr. Chan later, and those indications and contraindications, but I think that's the big one for keeping the legs high above the head. At level, slightly above is not terrible. Come on,
She looks
don't be shy.
Sorry, mate.
But what happened?
It throws your pelvic bone forward
What
again.
happened to our
Yeah.
spine, right?
It's not a natural.
You had a neutral spine and now it's in a tilt.
And then now we could be causing other things. Did you also notice, like, look, her legs were, sorry, roll over for me one more time. She's never gonna volunteer again. Thank you, Diana.
Might that help for somebody that has like lordosis?